Substance use disorders are extremely challenging to treat for a number of reasons. The first is that some drugs are seen as necessary aspects of life, particularly alcohol. So they're not even seen as a substance or a drug. And so people deny that they can have harms. On the other side, you have drugs which are illegal, and therefore people tend to, or some people tend to take the view that if you use an illegal drug, well, it's your own fault. And any harm that comes to you is due to the fact that you've broken the law. So they're very unsympathetic to treatment interventions. So you have this sort of moral position, political position. And then on top of that, of course, you've got different drugs have different pharmacologies and different harms. So you've got a very complex matrix of policy and medical problems from drug use. So the big challenge is to see whether we could find some kind of commonalities within drugs or within policies that could help us apply learnings from treating one drug to treating others. And really there are two main approaches to that. One is to have policies completely directed at reducing harms, such as, for instance, in the case of opiates, safe injecting rooms, what we call overdose prevention centers. On the other side, the new approach is to try to find treatments which disrupt the brain processes which drive addiction. And they can potentially help in any kind of addiction. They can help people stop having the urges to use. Substance use disorders and the harms from using substances are one of the leading causes of death. Over 7 million people die every year prematurely from smoking tobacco. Over 3.5 million die prematurely from drinking alcohol. And many million die from drugs such as heroin and other opiates and cocaine. So they're some of the biggest challenges to health in the world. In the last 10 years or so, there's been a gradual understanding that substance use disorders can be understood in terms of alterations in brain function, in brain circuits, in brain chemistry, and we can use those insights to target new interventions. So I've already mentioned the possibility of disrupting the circuits of addiction, and people are now doing that using agents such as ketamine or psychedelics, which can profoundly change the way in which people perceive their relationship with the drugs they use. But we can also target the chemical basis of addiction by focusing in on the particular receptors that drugs work on. So, for instance, drugs like cocaine work on dopamine receptors or dopamine systems. Drugs like alcohol work on the GABA system or the glutamate system. So we're beginning to develop specific targets for the interactions, the neurotransmitter interactions of some substances of misuse. And there's another very exciting development which has become possible because of our understanding of the brain hormones which regulate appetites. So there's quite a lot of work going on now trying to see whether by changing appetite, for instance, through receptors like the glucagon-like receptor, which is most people think of as being something to do with obesity. Well, we can stimulate those receptors with the agonists and help people control their eating. But interestingly, it may also help them control how much they're interested in alcohol or tobacco or even other drugs. So we can approach addiction now on many different levels by having a better understanding of the brain science underpinning misuse and dependence.